Okay, great.
Do you want me to let them in right now?
Yes, that'd be great. Thank you.
Okay. All right, I am admitting the people from the waiting room. Hello, welcome everyone. We'll get started here in 1 minute. All right, it's noon, so we are going to get started. Hello, everyone, and welcome to our workshop today with Child and Adolescent Psychiatrist, Dr. Jeremiah Dickerson, and Child and Adolescent Psychiatry Fellow, Dr. Aamani Chava. Did I say that correctly?
That's correct. Thank you.
Thank you. It's such a lovely name, and I want to make sure I do it justice. I'm Sarah Vogelsang-Card, Puppets and Education Manager at Vermont Family Network, and your host for today. Thank you for joining us for this in the series of 8 workshops in our Persevering in the Pandemic online learning series. If you missed our previous workshops, you can watch them on our VFN YouTube channel. The link is on our website, which is vermontfamilynetwork.org. Everyone who registered for today's workshop will receive a follow-up email with a link to this recording. We would like to recognize and thank our generous sponsors, which you see listed here, for making this learning series possible. Vermont Family Network has been serving families of children with special health needs and disabilities, the professionals who serve them for more than 30 years. And we are their federally designated Parent Training Information Center, the Family to Family Health Information Center, and the Vermont chapter of both Family Voices and Parent to Parent USA. Today's workshop is being recorded, so please keep that in mind as you share information on the situation. If you're comfortable, we encourage you to turn on your camera. Only the people who speak will end up in the final recording. And if everyone can please mute themselves unless they are speaking, that would be helpful. You can ask questions out loud or use the chat feature here on Zoom, which you'll see at the bottom of your screen. Please feel free to share info or links to resources that you found helpful in chat as well. We know that you can learn a lot from each other. I am excited to introduce to you Dr. Dickerson and Dr. Chava. Thank you so much for joining us today.
You're welcome. All right, we will get started. Thanks everyone for joining us. And thank you to the Vermont Family Network for extending the invitation to Dr. Chava and myself. We really appreciate the opportunity to support the Vermont Family Network and also to speak about this really interesting topic of anxiety. In any year, you know, speaking about anxiety would be interesting and hopefully engaging, but 2020 has brought a whole new context of stress and anxiety and uncertainty. And so both Aamani and I are hopeful that we can engage in some insightful conversation with you guys as our audience. And our hope is also to make this as interactive as possible. So like Sarah said, feel free to ask questions in the chat, and we hope to get to your questions throughout our slideshow, but also there will be time at the end, hopefully of the presentation, to focus on specific questions as well. Aamani, do you want to introduce yourself briefly?
Hi, everyone. My name is Aamani Chava. I'm one of the second-year Child and Adolescent Psychiatry Fellows, and I'd just like to thank you for giving me this opportunity.
Awesome. All right, so we're going to talk about worry, and we're going to talk about anxiety. And I just want to appreciate that this is a really stressful time, right? We've had a really stressful kind of, 9 months now. And, you know, I think there still is, even though I think there's less uncertainty in our world, there still is a lot of uncertainty in our world. And as a parent myself, I find it really difficult to talk to my own children about uncertainty and anxiety and worry. And I'm a professional. Aamani and I are supposedly experts in anxiety and experts in child development. And we struggle to talk about this, in part because we, frankly, are dealing with it ourselves. And I think that's one of sort of the take homes from this webinar too, is like anxiety is a perfectly normal, typical reaction that we all experience. Some of us experience it more often and more intense than others. And that's when it tends to rise to the level of warranting perhaps a diagnosis or perhaps some sort of focused intervention. But I think it's helpful to set the stage that we all struggle with anxiety. And I think as parents, that's also a useful kind of pointer to communicate to your children about and helps to sort of validate their feelings along the way as well. So with that, I just want to open up the chats to some questions if anybody is sort of feeling like they want to share a little bit. But I'm just curious, like what are people worried about? What do you find that the children you work with or parent are worried about? What's happening? Where is your anxiety coming from nowadays? Or are you not anxious and things are going well? We'd just love to sort of get a sense of what people are experiencing. It's been difficult to juggle all of the moving parts in the context of the pandemic, that's for sure. Thanks everyone for the chat. Yeah, juggling, working from home, remote school days. A lot of parents are now both parents and teachers, right? And that's something that I have found particularly challenging as a dad. Fear of getting sick. And some kids are getting more and more anxious about going into school because of worries about getting sick. And there's particular vulnerabilities related to certain populations, right? Like those who have developmental struggles, those kids that may have required more intensive supports in school and aren't able to access those supports now. And our family members, those of us who have some vulnerabilities with our own physical health and our parents who may be older as well. So there's some very justifiable fears out there, that's for sure. Can I ask how folks are coping? Like what have you found to be helpful over the past handful of months in terms of helping you relax, helping you manage this anxiety, helping you kind of manage these types of worries? Does anything come to mind? Yeah, hobbies especially. I've been doing a lot of jigsaw puzzles. I've turned into my grandfather during the pandemic as it was happening. Pets, herbal tea, positive self-talk, spending time in nature. Fantastic. For most people, the way that we've historically coped with feeling stress, feeling anxiety, or feeling worried is to connect with other people, right? And that's been understandably really difficult to do in the pandemic. And I think that's been difficult for me. It's not having that sort of social support system, at least in real time and in person. Excellent. Not watching news. Yeah, I'm hoping we can spend some time talking about sort of screen time and exposure to the media in terms of that being sort of having some positives and negative attached to it as well. Aamani, do you want to add anything before we move on?
No, I just think these are wonderful coping skills and techniques that everyone's using. I myself have been indulging in herbal tea as well as and watercolor painting actually has been a new one. So
It certainly has been a time that has fostered some interesting creativity in my family as well. We built like a massive gingerbread house the past couple of weeks, which we probably would have never done before if it wasn't for us being homebound a lot of the time. All right, can we have the next slide, please? Excellent. So here are just some kind of an outline of goals and objectives for the next 45 minutes or so. Just kind of talking about anxiety, talking about how it may present in kids in different periods of development, and then having a brief discussion about strategies that folks can use to help manage and treat anxiety and worry in kids and teens. Next slide. So what is anxiety? So another question for the chat. What does anxiety mean to you? What does it mean to you as a parent? What does it mean to you as a grown-up? What does it mean to your kids? What comes to mind when you just kind of hear the word anxiety? Anyone have any thoughts? Worries and fears, shaking, looping thoughts, especially at night, indeed. Stomach aches. Oh, this is fantastic. Thank you. I think one of the aspects of anxiety that this captures is we tend to think of anxiety in sort of different kind of buckets of symptoms or different buckets of features. And one of those buckets is emotional features. Like, how are you feeling? Are you feeling worried? Are you feeling anxious? Are you feeling angry? The other bucket is physical features. So sometimes when people get anxious or experience anxiety, they can experience stomach aches and headaches, and that's not all that uncommon in children, especially younger children. The next bucket is behavioral symptoms. So what happens when we get anxious or have sort of heightened fears? Our body is naturally primed to do what? To engage in this sort of fight or flight response. And so we often see those types of behaviors in people who are experiencing worry. And then the last bucket is sort of the cognitive bucket. So the thoughts that go along with anxiety. So you have the feeling bucket, I'm feeling worried, but then your thoughts tend to be like focused on certain fears. Like somebody said, there's looping thoughts, or what we call like perseveration or ruminative thinking as well. And that often occurs at night because that's a time when sort of we're not distracted by other things. And so I know from personal experience, when I try to go to sleep at night after a busy day or thinking about a busy week ahead or some other stress or anxiety, I have a hard time kind of getting those thoughts out of my head. And they certainly become looping as well. So it is useful to think about anxiety and sort of defined by those sort of 4 buckets of symptoms: the cognitive features or symptoms, the emotional features, the physical features, and the behavioral features as well. And again, anxiety is perfectly normal. It's our body's alarm system, right? It helps us conquer threats. It helps us manage fears. It serves a purpose, but sometimes the anxiety can become overwhelming. It can occur too often. It can occur too much. It can get to the point where it never goes away, and it can get to the point where it's difficult to control. And that's when it sort of rises to the level of perhaps warranting a visit with a health provider and perhaps a diagnosis, and then, like I said, some intervention as well. So that's sort of kind of anxiety in a nutshell, thinking about sort of the characteristics of anxiety. Next slide, please. So how common is anxiety? I'm curious, yes or no question for the chat. How many of you know somebody who has a diagnosis of an anxiety disorder? Yeah, indeed. A lot of yeses. Perfect. Thanks, everybody. So anxiety disorders are the most common of all childhood and adolescent mental health conditions. And we can kind of get to numbers in a little bit. And there are different types of anxiety, which we can chat about as well. But a lot of people struggle with anxiety, and there's some evidence to suggest that more and more people are struggling with anxiety. And we're going to talk about that in a little bit as well, because the numbers are rising. The numbers were rising even prior to the pandemic. And people have sort of speculated about the different reasons for that. I think one of the most sort of optimistic reasons for that is that we're able to do things like this. We're able to kind of talk about anxiety. We're able to normalize it, especially with kids and teenagers. And the hope is that that sort of A, demystifies it, B, again, it normalizes it, and C, it sort of takes away the stigma attached to like, oh man, I'm feeling this way and I don't want anyone to know about it. I'm a firm believer in our world of mental health that the more that we're able to talk openly and honestly about what we're experiencing and feeling, the easier it's going to be for the next generation of folks to engage in those conversations as well. Aamani, do you have any thoughts about this?
I think that remembering that there's the concept of strength in numbers is so important for something relating to mental health, that it's so easy to feel alone and isolated, especially in times like this. And to know that you're not the only one out there, your kids aren't the only one out there that are struggling with anxiety or behavioral or mood disturbances. And like Jeremiah said, part of it is so normal. And I think to be able to talk about it, to verbalize those things, is probably one of the most beautiful things that I've seen in my practice so far. And having that conversation sometimes alleviates some of that anxiety right away, like that weight that gets lifted. And I think that continuing to do things like this is really important for, everyone's mental health.
Excellent, well said. All right, next slide, please. There's a question in the chat, or the statement in the chat about not seeing the slideshow. Hopefully everybody can still see it. I can see it, perfect. So anxiety is really common. About 1 out of every 6 children in the United States would meet criteria for a mental health disorder in general. And so that's thinking about not only anxiety, but like depression. We talk about ADHD. We talk about some of behavioral disorders that we see, oppositional defiant disorder, and other sorts of things. At some point, around 30% of kids and teens will meet criteria for an anxiety disorder. That's a pretty significant number. The worry we have in our world of child psychiatry is there's data to indicate that about 80% of kids and teenagers never get intervention or never get help. So another question for the chat is, where do you think that number comes from? Why do you think that we have all these kids and teens who are experiencing anxiety and worry that rises to the level of a diagnosis, yet the vast majority of those individuals are not getting the help that they need? What do folks think of that? I think Aamani and I are hopeful that those numbers are changing, that percentage is shifting downward, but it's still a significant problem.
Yeah, and these are the latest figures as of 2019 that we have up here. So we're hoping that we don't see a spike, or even if we do, we're hoping that it's addressed a little bit better, and more people are seeking the proper interventions for it.
For sure. I can tell you one of the reasons that I suspect that around 80% of people are not getting the help they need is yeah, Karen, like you were saying, the symptoms aren't being recognized, but there's also not enough of us. I think thinking about mental health providers, not just physicians, doctors, but sort of master's level clinicians, social workers, therapists who are really doing the day-to-day work in terms of engaging families in evidence-based therapy. There's not enough of us. And so there's not enough of us, people are less likely to kind of seek out care, because who wants to be put on a wait list, right? And just kind of sit there and wait things out. And I also think we need to do a better job in our field of child psychiatry of engaging primary care doctors and pediatricians and empowering them to have these conversations with families and give them a sense of what's out there in terms of treatment providers that can be helpful. Because it's the primary care doctors that are also seeing the majority of these children, of these kids. We in child psychiatry, you know, we tend to only see the kids who are struggling the most. And so there's a fair number of kids that don't make it through our doors, and nor should they, because there's also a lot that can be done day to day in terms of just parenting techniques and parenting skills, and kind of teaching kids about anxiety in the school system that can help kind of offer some intervention and treatment as well.
And I think, Karen, you make a really great point by saying maybe not recognizing symptoms as well, because what we just covered and what Jeremiah just kind of went over with the 4 different buckets is it manifests in so many different ways. And so kind of understanding the concept of anxiety, understanding kind of the etiology of it, I think is part of the struggle for a lot of those who suffer with anxiety or those who are evaluating those with anxiety. So, you know, part of it is about education and recognizing what we're seeing.
And also thinking about, man, if you're anxious, you can become anxious about being anxious, and therefore you're less likely to seek out help because you're anxious about what are people going to say? What are they going to recommend? Are they going to make me go to an inpatient facility? Which are very valid questions. And those questions tend to kind of rear their heads a little bit more intensely if you're experiencing anxiety. You know, there's a lot of sort of quote unquote silent sufferers out there who, you know, just kind of learn to live with their worry and their fear. But again, those are the people that aren't necessarily seeking out help or kind of presenting to their primary care doctor or certainly a psychiatrist as well. Next slide, please. Thank you. Aamani, do you want to kind of describe this?
Absolutely.
Yeah.
So what does anxiety look like in terms of, as we see this iceberg model here, of what we're feeling versus what's actually being portrayed outside of that? And going back to those 4 buckets that Jeremiah talked about, it can be physical, it can be cognitive, it can be behavioral, and it can be emotional. And more often than not, the emotions that we're feeling, especially as a child, are not always verbalized the appropriate way. So sometimes we're seeing kids who are extremely agitated and aggressive, and we assume, you know, it's just a behavioral disorder, but without proper evaluation of what's kind of underlying that. For example, anger, sleep issues, and defiance. But it can really be that the child is feeling overwhelmed, depressed, insecure, and hurt. And so really delving into these symptoms and understanding where it's coming from, where some of the stress is coming from. And as we talked about right now, there's a lot to be stressed out about. And having these conversations, I think, kind of going back to that basic point, is something that we find really beneficial and important of understanding why are kids feeling the way they're feeling, why are parents feeling the way that they're feeling, and to be okay with those feelings.
I feel like I've said the phrase, it's okay not to be okay, a lot over the course, not only to my patients, but to my own family and to myself pretty much every day. It's what it's become, but it's okay not to be okay. And, you know, like Aamani was saying, taking a deeper dive in terms of figuring out what's driving these behaviors can be really challenging for parents, especially parents who are dealing with their own sort of mental health kind of struggles. So if you're an anxious parent, you may feel more anxiety when your kid's increasingly defiant, or your little boy is not able to focus on the Google Meets meeting for school. And so you find your own anxiety kind of ramping up, and that may lead to more avoidance, right? And that avoidance may lead to you not kind of being able to tolerate your child's behavior, or even exploring it further. So you can quickly get a sense of sort of this kind of dynamic that we often see in families, that gets really, really nuanced, thinking about how a parent's anxiety or a parent's depression or a parent's own sort of stress kind of impacts the child, or their kids in terms of their presentation, and their ability to kind of talk openly and honestly about feelings within the family. So it does become tricky, and that's not uncommon at the same time. So this is something that strikes, I think a lot of families out there as well. All right, next slide. Thank you. And this is just another illustration about ways a child's anxiety may show up as something else. So for those of you that are familiar with like elementary schoolers, like 3, 4, 5, 6-year-olds, preschoolers as well, what are the chances that your preschoolers, when they're upset, have the language to say, "Mom, Dad, I'm worried about blank"? You'd have a pretty precocious preschooler if they were able to do that. And even my kids, who have 2 child psychiatrists as parents, are not even close to doing that. And so it really is important to, again, pay close attention to the behaviors that you're seeing, because those behaviors may look like something, but may mean something else. And so here you can see just kind of anxiety and how it may manifest with anger, difficulty sleeping, defiance, lack of focus, avoidance, negativity, over planning, perfectionism, those types of things. So these are not uncommon sort of behaviors that we see in a range of kids who experience anxiety and worry to different extents. All right, next slide, please. Aamani, do you want to take this one?
Sure. I think going back to what we were talking about appropriate diagnoses, anxiety doesn't necessarily have to occur alone. It can, but actually in about 50% of children and adolescents, it occurs in conjunction with something else. And these can be very varied, just like how anxiety can manifest very differently. We can see issues in school with learning disorders or language disorders. We can see that oppositionality, that defiance that may get diagnosed with, and the child may get diagnosed with oppositional defiant disorder, attention deficit hyperactivity disorder, or conduct disorder. Sometimes in adolescence, this can lead to self-medicating and substance use disorders, whether that's with alcohol, marijuana, benzodiazepines, and there can be internalizing concerns. The idea of I'm so anxious about being anxious that I'm upset and I'm depressed about being anxious now. And these are not uncommon either in terms of it. Anxiety doesn't have to be a lone phenomenon. It can occur in conjunction with something else, and it can be treated in conjunction with something else.
Excellent. Yeah, and it can also, even be difficult to discern symptoms of what's anxiety versus what's ADHD. And because there is a lot of symptom overlap. And we see that especially with kids who struggle with learning issues, who may get diagnosed with a specific learning disorder and require some special education or additional support in school. There's a lot of symptom overlap with anxiety and learning struggles. And you can imagine, like, if you have awareness of how hard it is to be at school and learn and keep up with the other kids, like that may foster a lot of internal worry and a lot of avoidance. And so it really pays to kind of take a deeper dive again into the sort of behaviors that you're able to see on the surface, and really trying to figuring out what's going on internally with kids. Next slide, please. And what causes anxiety? Well, this is a whole nother like full day talk unto itself, right? So we're not going to focus a lot on this, but it's just useful to know that anxiety is really remarkably complicated in terms of its etiology and in terms of what drives anxiety. It's multifactorial. For many, many people who struggle with anxiety, it's not one thing that is sort of the direct cause of the anxiety and worry. There's developmental factors, thinking about kids who are just inherently shy or what we call behaviorally inhibited, which is a certain percentage of the population, and that's not pathology. That's just sort of how people are wired and part of kind of the normal continuum of typical behaviors. But sometimes that can be predictive of a type of anxiety called social anxiety disorder. There's cognitive and learning factors as well. Some of us are just wired to kind of see things through the lens of a more, what we call like a hostile attribution bias, meaning that when we perceive threats more, sort of more frequently than other people, or we may misperceive other things as being threatening than the rest of the population. There's neurobiological factors, there's genetic factors. So there's no one gene that causes anxiety. But we do know that if you're a parent who struggles with anxiety, there's a significant chance that your child will also struggle to some extent with anxiety, worry, and other internalizing disorders like depression as well. And then there's social and environmental factors that play a role. And I think we can sort of speak to this, thinking about the last 9 or 10 months, where there have been a range of factors socially and environmentally that have contributed to a lot of our own anxiety. Thinking about the pandemic, thinking about the political climate, thinking about the social justice issues that we've all kind of had to reckon with the past handful of months as well. There's a lot to think about. And again, there's still a lot of uncertainty. And the holidays, it's the holiday season. And so for a lot of families, this is regardless of the pandemic, this can be a terribly stressful time of year, right? For a variety of reasons. And so I think that also kind of plays a role in kind of leading to more anxiety as well. Next slide. This is just an illustration of sort of the underlying neurobiology of anxiety. And I think this is just useful to think about because part of the role of interventions is we want to tamp down the amygdala. So the amygdala is sort of the center of our brain that sort of drives emotions. It can sort of drive eventually this sort of fight or flight mode that we often get in when we're feeling anxious or fearful or worried. And again, perfectly normal, perfectly natural. But thinking about what we can do to tamp down the amygdala is really important. How do we teach people skills, teach kids skills that may indeed help kind of lower the amygdala's reactivity? And there's more and more evidence that there are a lot of things that we can do as parents, as friends, as people in our children's support system, as teachers, that can really help to kind of tamp down that amygdala and kind of minimize one's reactivity. Next slide. So this is just, I think, an interesting quote from this book called Under Pressure that specifically speaks to anxiety and worry in girls. And there has been more and more evidence that females are exquisitely more sensitive to experiencing anxiety. And again, there's a lot to that. But I think that you can see the second paragraph. If we respond to all stress and all anxiety as if it were harmful, we actually run the risk of raising a generation that becomes stressed about being stressed and anxious about being anxious. So it really is interesting to think about, like, again, our role as caregivers, our role as grownups to normalize the anxiety, to validate kids' worries and emotions, and help them develop the skills in which to manage it. For a lot of people, the anxiety may never go away, but what people can learn is that they can develop control over it, they can become more empowered. to say, no, 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 like I have the skills in which to tamp down this alarm system. And I think that that's a really important message to kind of take home. Next slide, please. Aamani, you want to discuss this?
Sure. We wanted to display this in a fun way. And as you probably see, we used a lot of memes throughout our presentation today. But genes and environment, kind of going back to that idea of where is your anxiety coming from? Is it something I was born with? Is it something I've developed over time? Is this something that I've learned from watching those around me? And the answer is, we're not really sure. It can be all of the above, it can be none of the above, and it can, it can be situational. I can't think of a single person who's not anxious in this current pandemic time, that at one point or another in the past 9 months. So what we wanted to highlight is trauma and abuse obviously will predispose a child to anxiety. They'll have development of anxiety and have anxiety in situations thereafter. And some of this attributes to what Jeremiah had mentioned before about social anxiety in situations where it might trigger a response based on a previous experience. The school environment with peer relationships and bullying. Sometimes school can be a very strengthening place for a child. Sometimes it can be a very unsafe, and it may lead to a lot of insecurity for a child. And as we had spoken about before, that's maybe why we're seeing a decrease in anxiety for some kids, for some very anxious kids, where a lot of it did come from the school environment. Part of it could be family history, where kids are very susceptible to, we talk about modeling, and the behavior that they see at home is what they learn. And this doesn't have to happen to all children, but if you have an anxious parent, chances are there is a possibility that you may have an anxious child. How we as parents respond to a situation is how a child may learn to respond to a situation. And so that manifestation can't be ignored. And the data just shows that children of parents who have one anxiety disorder have a 2 to 4 times increased risk. And any kind of affective mood disorder, whether it's depression or anxiety, can manifest in a child based on the environment that they're in. So I think, again, that education about how we are responding to our children is something that's really important to remember in the midst of stressful situations.
Great. Next slide, please. So this is just kind of focusing on the manifestation of anxiety in young children. So you can see sort of the numbers here that there's data to indicate that between like 8 to 10% of preschoolers met criteria for not only one mental health disorder, but more than one mental health disorder. And this is, I think this is also another conversation in terms of where those numbers come from, but it's striking nonetheless, right? And 19% of preschoolers met criteria for an anxiety disorder in the data that we have. And so that may rear its head as sort of generalized worry, generalized anxiety disorder, separation anxiety disorder, social phobia, and other things. And, the trajectory tends to be that if the anxiety is not sort of recognized and treated effectively early on, there's a chance that it can continue to sort of rear its head in different ways throughout childhood and adolescence, and can contribute to sort of a range of functional impairments. If you think about kids not wanting to go to school, kids not attending in school, social problems, et cetera, et cetera. And in the table here, you can just see sort of some features associated with anxiety. So again, anxiety, perfectly typical, normal, but when it becomes distressing, pervasive, uncontrollable, persistent, and impairing, that's when, again, it may warrant a diagnosis and warrant intervention as well. Next slide, please. And here are just some of the features of anxiety that may manifest in young children. Again, thinking about sort of physical signs, thinking about emotional signs, thinking about behavioral signs. I think one of the things that comes to mind for me is just sort of the level of irritability that we may see in a lot of kids who experience anxiety. Again, it's super non-specific, and it may be tough to tease that out, But a lot of anxious kids demonstrate a lot of moodiness and irritability, particularly thinking about elementary schoolers and middle schoolers. Next slide, please. And then in teenagers, anxiety may manifest a little bit differently, where teens may be more perfectionistic. They may be having this drive to succeed, experience a fear of failure. And it does raise the question, is our culture sort of fostering anxiety? Is our culture sort of fostering worry? And I don't think we can really answer that, but some folks would argue, yes, indeed, thinking about sort of the expectations that we as parents put on our children, that the school puts on their children, the expectations that social media puts on teenagers especially as well may contribute to some higher rates of anxiety and worry. And one of the concerns that we have with anxiety in teenagers is it often co-occurs with depression. And with depression, we think about, concerns relating to self-harm and suicide. And so there is a link, linking anxiety and those concerning unsafe behaviors. And that's something that we pay a lot of attention to in the teenagers that we see who experience anxiety, particularly teenagers who experience panic. Because those of you that have experienced or have known somebody who has had a panic attack or displayed symptoms of panic disorder, often you are not engaging that part of your brain that thinks logically and rationally, right, during those times. And that's when sometimes people will do things impulsively and unsafe in order to kind of take the panic away. And so we pay a lot of attention to that possibility in certain populations. Next slide. Another tremendous quote. This is from the website childmindorg, which has a really fantastically rich wealth of information on it about a variety of childhood emotional and behavioral concerns. But you can see here, anxiety is one of those diagnoses that's the great masquerader. It can look like a lot of things, particularly in younger kids who may not have the words to express their feelings, or because nobody is listening to them. And it might manifest with a lot of behavioral dysregulation. Next slide.
May
Aamani,
I interrupt for 1 second?
Yes.
I just want to say that we're 19 minutes until the ending.
Okay.
We would like to ask if it's okay for both of you, if we could go 15 minutes over. And for any of our attendees, if you have to leave, this is being recorded. It'll also be on Facebook. But are you able to, Dr. Dickerson and Dr. Chava, to go 15 minutes more?
I am, yeah.
Yes, absolutely.
Okay, wonderful. So then we'll continue and go 15 minutes over. So then I'll give you, at 1 o'clock, I'll let you know when it's 1 and there's 15 minutes left.
Okay, perfect.
Thank you.
Aamani, do you want to talk about social media?
Sure. This is one of those questions that has come up more recently with just the increase in the types of social media and the various degrees of social media exposure that children have. And this is just a representation after there was an analysis of thousands of adolescents' reaction to digital stressors. And it's really interesting to think about how each child kind of responds to social media and how that may contribute to anxiety. So this idea of feeling replaceable because everything is so instantaneous, of not responding to your best friend's post. Will she find a better friend? Did I just get taken? I don't know if anyone remembers the days of MySpace, but there was a top 8 back then, and you could very well be removed from that top 8, and it felt like your world was crashing down. Too much communication. Everyone has their phones on them. We are attached to them. They are part of our lifeline nowadays. So instant communication, if someone does not respond to you right away, does that mean they're mad at you? Does that mean we were talking about looping thoughts and how these can get really perseverative and ruminative in terms of reading into a situation and thinking of the worst possible scenario, call this catastrophic thinking. Digital FOMO, posting on a regular basis, whether that's YouTube, Instagram, Snapchat, whatever social media that may be popular nowadays, that will that prevent you from being part of a real conversation the next day because you didn't post? You're not up to date. And then, the attachment to our phones, attachment to our computers, to any sort of social media that we can cling to. Are you going to miss a message? Is it the end of the world? These thoughts that kind of are so pervasive for a lot of children and adolescents these days, and how that's contributing to this increase in anxiety that we're seeing.
Great. Next slide, please. This is just an example of how anxiety may be manifesting on social media, thinking about the teenagers and adolescents sort of who are on social media a lot and not getting the response that they need, and then just kind of engaging in this type of thinking that you can see kind of make quickly and kind of devolve and translate into more and more anxiety. All right, next slide. And this is just essentially saying that teenagers, adolescents are on technology a lot. 45% of teens, and this is from a couple of years ago, say they're online almost constantly. And so this is something that deserves a lot more exploration, a lot more research, and thinking about how this is translating into anxiety, how it's translating into other things, and how it's affecting the brains of the teenagers in 2020. Next slide. And this is just an illustration from a couple of years ago that looked at like different social media platforms, Instagram, Snapchat, Facebook, and Twitter, and how teenagers and young adults reported the impact on their well-being. The darker the red, the more negative the impact. And so you can see here, teenagers and young adults are endorsing the fact that Instagram is really affecting their sleep negatively, or Facebook is really impacting bullying, and Instagram is affecting body image in a negative way. And so even though there may certainly be positives to social media, there's a really delicate balance here, I think, between the potential negatives and the positives of engaging on social media and engaging on a lot of social media, particularly for adolescents who may be vulnerable to experience anxiety to begin with, that this may sort of ramp that up pretty aggressively. Next slide. So I think we've chatted a little bit about most of these bullet points, that there is an increase in folks presenting with anxiety, and there's a lot of different reasons why that might be true. And so I think this is just worth keeping in mind. Next slide. And there's data to indicate that the current generation of teenagers and young adults is the generation that's endorsing the most worry and endorsing feeling the most stressed. So this is also something to sort of keep in mind as well. So Gen Z, least likely to say their mental health is excellent or very good. And I think there's different ways to interpret this. I think one of the ways is which they're more open to kind of endorse this and disclose sort of what it is they're really truly feeling. So, but it's important to kind of appreciate nonetheless. Next slide. So how do we diagnose anxiety disorders? Well, for some people it can be pretty straightforward, but for other folks, it can be relatively more complicated, thinking about sort of those different manifestations, how it may overlap with different things. And so this is where we can play, hopefully, a pretty significant role in helping to tease some of this out, gathering information from multiple sources. Teachers are so valuable in terms of the information they're able to provide us, and thinking about how kids are behaving in the school environment. And we do appreciate that anxious kids often display symptoms differently in different settings. And so it's part of our job to kind of reconcile all of that information, like what's going on at home versus what's going on at school, and how do we most make sense of that. And so we tend to get a lot of information from a lot of different people. And then there's some rating scales that we can use as well. Next slide. This is relatively new data. Again, just thinking about how many kids are struggling, how many teenagers are struggling with mental health conditions. There are a lot of folks out there. So we just wanted to kind of, again, talk about this. And again, to think about like what's going on, because the vast majority of these kids are not getting the intervention and the treatment that they really truly deserve. Next slide. Aamani, do you want to provide an overview about treatments?
Sure. The treatment of anxiety can look very different depending on the setting because of how anxiety is manifesting in each setting. So part of what we've kind of already talked about quite a bit today is the psychoeducation, and knowing that the manifestation of anxiety there's no black and white picture. There isn't a set criteria. Well, there are set criterias, but everyone can manifest in a different way until proper evaluation and how to treat it. One of the things that we are very, very passionate about here at our clinic is the family involvement in treating children's anxiety, and the importance of involving the family unit, and understanding that the heritability and genetic predisposition to anxiety, that helping the family will help the child at the end of the day. Collaborating with school, like Jeremiah said, school is probably the first line of sometimes when anxiety is recognized, and teachers will make that observation and will probably send the referral over to a parent before they come into our clinic. So collaborating with the school and understanding how that anxiety is manifesting at school is really important to treating the child. Psychotherapy, CBT, is probably one of the most talked about therapies for treating anxiety, and it's extremely effective. And so we'll go a little bit in detail about that. Wellness strategies, talking about that mind-body connection, some of the physical manifestations of anxiety that we talked about before, where your brain is activated, your amygdala, and that's activating your autonomic nervous system. That's when you're feeling sweaty palms, racing heart, the tremulousness and the anxiety, the butterflies in your stomach, and how we can use mindfulness, yoga, and exercise to kind of combat that and control those responses. And then, of course, we also have medications that have been proven effective for treating anxiety, and when and that might be necessary in terms of after being properly evaluated.
Next slide, please. So we've focused a lot on psychoeducation, like Aamani said thus far, but using sort of the terminology, the sort of most appropriate terminology to talk about anxiety, I think is really helpful in thinking about where a kiddo is at developmentally and what they're able to appreciate and understand can be really helpful. Often using the false alarm metaphor is helpful. Like this is your body's way of telling you that something is wrong. And your job is to kind of tamp it down, and we're gonna develop those skills together and learn how to do that. Validation and reassurance can go a long way, and also teaching kids how to recognize sort of the early signs physically of anxiety. Like if you're waking up and experiencing some butterflies in your stomach, well, here's what that might mean. It doesn't necessarily mean that you're going to get physically sick, but it may be your brain's way of telling you that you're worried about something, or you're feeling uncomfortable about something, and that can often be sort of a starting point for conversations about anxiety and worry. Next slide. All right, CBT. So Aamani mentioned CBT, which is cognitive behavioral therapy. And this is the type of therapy that has the most evidence for addressing anxiety disorders in pretty much people of all ages. And so it's worth recognizing CBT for what it is. And the goal is to sort of change maladaptive learning and thoughts, to provide tools to people to sort of help manage the anxiety, managing strong feelings, not necessarily take it away, but learn how to manage it and learn how to unlearn maladaptive behavior and build skills, changing your distorted thinking. Like, man, I'm really worried about going outside because I might get COVID. well, yeah, that's a valid thought to have, but what are the chances that if you're taking all the precautions and washing your hands and wearing a mask and staying socially distanced, that that's actually going to happen? And so that could be a technique just to take a deeper dive into that distorted thinking to allow people to build insight in thinking about how those thoughts certainly, you know, are again valid and perhaps appropriate, but may lead to anxious thinking and anxious behaviors. Next slide. And then this is just sort of what we mean by like the cognitive piece of CBT, cognitive restructuring. And we do this all the time, where if we're having certain thoughts, we can learn how to catch ourselves, to check ourselves, and then change those thoughts to something that might be sort of less anxiety producing. This may come naturally to some people. For most people, it does not, particularly if you're in that anxious state. Like, what are the chances you're going to take a step back and catch yourself and check yourself? But with a little bit of coaching from a therapist or somebody else, like this may become easier and easier to do. And we know that, you know, our brains are built in a way to sort of build this skill up over time. Even from a young age, thinking about kids who are in elementary school may be able to do some of this to some extent as well. Next slide. And then exposure and response prevention is a form of CBT, and that's where we kind of foster empowerment and foster control that can help people kind of systematically kind of recognize their anxious thoughts and build the skills up to manage them. Like the classic example is somebody who's afraid of flying, right? And really has a lot of anxiety about getting on an airplane. Well, you're not going to force that person to get on an airplane. That may not be all that effective, but talking about airplanes may be a step in the right direction. And then looking at pictures of airplanes might be the next step. And learning your body's response to that and learning ways in which to kind of manage that response over time can be really, really helpful if it's done in a gradual way that really engages a partnership between the patient and the therapist, I think is really fruitful. Next slide. And I'll let Aamani share about wellness strategies a little bit, because I think these are often have the most bang for the buck and can be the easiest to implement, but often aren't things that we necessarily think about as first-line treatments of anxiety.
Right. So kind of going back to what we had talked about a little bit about the mind-body connection. And I think we've all heard that exercise is good for us, but taking that time out to get that exercise is not easy, especially in the midst of a global pandemic when we have fears of going outside. But like Jeremiah said, in terms of taking the proper precautions of wearing a mask and getting, and I think a lot of you actually said that one of the coping skills that you were using was getting outside to get some fresh air. And that's a very healthy one, because research has shown that if you're able to do even as little as 10 to 15 minutes of exercise per day, it makes a difference in terms of just getting that physical activity and getting your body moving. And I'm sure everyone is familiar with the phrase Zoom fatigue nowadays, of sitting in front of your screen and staring at a computer. So even if you're not outside and you take that time to walk around your house, backyard, wherever it is, it does make that little bit of difference of being able to step away. In a non-pandemic world, exercise can be a form of social interaction, of support, of being able to build relationships. And gaining confidence. Research has shown that having exercise and physical activity and meeting those little exercise goals of I'm going to walk for 10 minutes today, I'm going to walk for 15 minutes today, can actually increase our own self-esteem. And then we talked about distraction, and exercise is a great form of that. When you're in that zone of walking, running, biking, whatever it is that you like to do for exercise, it can actually distract you from those ruminative thoughts, those perseverative thoughts that we had talked about, where it's that cycle of negative thinking. And it kind of helps you break away from that for that time being. And again, we're training our mind to do this during that period. So practice makes perfect in a lot of these cases. Next slide, please. Another form of wellness strategies that we love here at our clinic is mindfulness and meditation. And this actually has shown a lot of promise and evidence-based research regarding that amygdala response that we talked about, where that normal fight or flight response that we have that can be exacerbated when we are prone to being overly anxious or having those catastrophic thoughts, it actually decreases that activity. It increases your inhibitory signals, which is GABA, and it decreases cortisol, which is our stress hormone. So mindfulness and meditation can look it can be so different and look in so differently depending on what you like and who you are as a person. So we have yoga, we have Tai Chi, you can dance and meditate nowadays. There's relaxation responses, there's breathing focused meditation. And depending on the time of day, depending on when you have that ability, these exercises can range anywhere from 2 minutes to 30 minutes. So even stepping away for a little bit, like we talked about, if not for exercise, for meditation, has shown that it promotes a state of calmness that is really beneficial and actually increases your productivity once you do return to that task at hand.
Great, next slide. So I think this is something that we've touched upon a couple of times during the course of the last hour, but anxiety in children cannot be treated in the vacuum. It's often a family-focused approach to intervening and managing anxiety. And that's really important because, again, we think about sort of the genetic link between parental anxiety and anxiety in children, but also the fact that kids take their cues from their parents pretty much 24/7. And so we have to learn to be much more mindful about how we're sort of conveying our own selves to our kids, and learn how to manage our own anxiety and learn how to manage our own stress and model tolerance and model self-care. And again, also have open and honest conversations about feelings and emotions and permit the children to feel their own stress and feelings and validate that, but work together to develop skills in which to manage it and overcome it. You know, avoidance strengthens anxiety, right? But brave behaviors will strengthen children. And so we often talk about not only the alarm system and tamping that down, but how do we foster brave behaviors? How do you, as an 8-year-old, learn to overcome this worry? Because you can and you will. It might take some practice and time, but we can do that together as a family. And then it's really important for parents to find time to take care of themselves. You know, we could do a whole nother talk on this, but it really can go such a long way that if you're feeling stressed or anxious, you're likely not going to be in the best state of mind to respond to your kid's anxiety or respond to your child's worry or disruptive behaviors. And so it may be important to take a little break and to take care of yourself and regroup and learn how to recognize that and when you are in your best kind of mode to be the best parent you can be. Next slide, please. And there are a lot of tools out there for parents that fall under kind of the CBT umbrella. One of the tools is called SPACE, which is relatively new. And one of the aspects of SPACE that Aamani and I really like is that it focuses on family accommodation. So again, avoidance fosters anxiety. And if you're an anxious parent and your kid expresses worry about school, chances are, or not chances are, but you may say, all right, you don't have to go to school today because you're feeling worried and you're making me worried. So we're just going to avoid it. And that may be helpful in the short term. You may have a fun day at home, kids' anxiety may lessen, but a kid's job is to go to school and to learn. And so that might not be helpful in the long run. And so engaging in those avoidant behaviors is called accommodation. And a lot of times we do that without even thinking about it. It's just unconscious. And so this type of treatment brings that to awareness and provides some opportunities for parents and families to sort of work on that and to mitigate the frequency of accommodation and that fostering anxiety over the long term. Next slide, please. And there are different parenting styles out there, and we all recognize this, and we all kind of fall into one of these categories at one point in time. But parenting style can influence a kiddo's behavior in a variety of different ways. And it can be a really complicated dyadic interaction that really takes some exploration. But there are some parenting styles that can encourage avoidance, foster accommodation, thinking about the parents who tend to be overprotective of their children, in part because you're anxious yourself as a parent. So it's worth sort of paying attention to this and kind of exploring this a little further if indeed you want to take the time to sort of examine what may be driving the anxiety in the family. Next slide. And there are many things that parents can do to sort of kind of escape the cycle of anxiety. And I think we've chatted about most of this, but it's all about like learning how to manage uncertainty and manage uncertainty in a sort of a family-based approach, and really trying hard not to avoid all the time, being honest and open about emotions and feelings. And really trying hard not to reinforce fears and focus on the positives. What's going well? What are we doing to keep ourselves safe? And that can be really helpful for families. And it's also helpful to just be mindful about media exposure. There's a lot in the media right now, and there's a lot that sort of fuels uncertainty and fuels anxiety. And some of that may be really difficult for young kids to make sense of. And so part of our job as parents is to really pay attention to that, and really be quite mindful about sort of the news, the internet, even if it's on in the background, that kids may be picking up on things that may be driving some of their anxiety and worry. Next slide. And lastly, even though, you know, medications are important, but in kids and teenagers, medicine should never be used in isolation, particularly when treating anxiety disorders. And so we just wanted to kind of put this slide in there because they are part of the kind of the toolbox for treating and targeting anxiety in a wide range of ages and populations. They're not for everybody, and we recognize that, but they can be also life-saving for some people as well. So it's useful to recognize sort of where medications are in the grand scheme of intervention. Next slide. And for people who really struggle with significant and severe anxiety, combination treatment is sort of the gold standard of treatment. Combination meaning a combination of using medicines and engaging in evidence-based psychotherapy, like cognitive behavioral therapy, has the most bang for the buck in terms of promoting positive outcomes. Next slide. All right, and we just wanted to kind of end, share some resources, some good books and some websites that folks may find helpful for learning more about anxiety and talking about anxiety in the pediatric population. And then our last slide is just some references as well. I think we have a little bit of time for some questions, and I would like to thank everybody for participating and for joining our webinar. I know it's not the most ideal venue for talking about this, but again, it's been a real pleasure to sort of share this information and to engage with you all. Thank you.
Thank you, Dr. Dickerson, and thank you, Dr. Chava. So we do have time for questions. If anyone would like to, you can say a question or you can put it into the chat box, but feel free also to ask the question out loud if you'd like to. I did see one question come up. What does CBT, what does that stand for?
CBT stands for Cognitive Behavioral Therapy.
I have a question.
Sure.
So our puppet program that we do with Vermont Family Network, we've been trying to students kind of personify their anxiety or worry, and with some kids, so they can talk to it. And for some kids that comes easily, and for others, they really don't grasp it. I was wondering if you might have any guiding questions to ask to a child if you want them to kind of put that worry outside of themselves.
That's a great question. I love the phrase, if you can name it, you can tame it, right? And so putting words to something is really, really important, but it can be more challenging for some folks, especially kids who may not yet have the sort of the insight in the language in which to kind of externalize some of that. Karen, my advice would be to start with something physical and something behavioral. Like, what are you, not so much what are you feeling, but what does your head hurt? Does your stomach hurt? Do you have trouble walking? Are you shaking? Starting with those more somatic sort of bodily symptoms, physical symptoms of anxiety can be easier for kids to kind of focus on. And using that as the foundation in which to externalize that might be helpful. Aamani, do you have any thoughts?
No, I would agree with that. I sometimes also try to have them, if they're of the younger age, draw something that feels like anxiety. And sometimes kids will draw butterflies in their stomach instead of actually saying it, or like spirals in their head, and just to almost demonstrate like a foggy mind or like a very tumultuous thoughts in their head. And so drawing can be somewhat beneficial with a child who's willing to do it.
Thank you.
Another question we had come in is, can you share any creative family strategies that have been helpful for families who have several members with an anxiety disorder? We recently started a gratitude conversation starter at dinner time, and it's been helpful. What are other ideas that you have?
Good question. My first thought is to, first of all, having a time to express gratitude as a family is just really, really wonderful. So that's really amazing. And hopefully that'll continue to kind of be positive and beneficial. Physical activity, I think, can be a really kind of helpful route to kind of start to engage in some of those conversations too, because your body's sort of distracted. And, it allows you to kind of have some conversations that you may not be able to have sort of face to face, because it might be easier to do when you're going on a hike together. It also offers an opportunity to focus on breathing, which I think is one of the core components that we talk about when we think about mindfulness and we think about yoga and sort of centering and grounding ourselves. So attending to the breath can be really, really helpful in terms of managing our body's alarm system. And there's some really great videos. Like I think Elmo has a video about belly breathing, right, Sarah, that I think we've watched before. Yeah. And just kind of teaches kids to like learn how to breathe in a little bit more of an adaptive manner that helps kind of manage anxiety. And you can make it fun. People exercise that by like blowing out candles or practicing, different types of sort of breathing techniques.
Are there any more questions? Well, then, since we're at 1:11, I'm going to wrap it up and say thank you again to both of you. As one person said here in the Zoom chat, which I'd like to repeat, was appreciate your kindness, acknowledgement, and humility. This was very good, and we'll share out the presentation to others I know who could not attend. Thank you. And that was from Jen Woodward, and she hit the mark. Absolutely.
Thank you.
Thank you so much. Also, for people who are here in attendance, please take a few minutes to complete our evaluation. We'll be put in the chat here so that we can make improvements and fulfill our grant requirements. There's one more workshop in our free online learning series. Details are on the homepage of our website. Again, that's vermontfamilynetwork.org, along with the links to the previously recorded ones, including this one, which will be on there too. You'll also find our SIP Shop schedule for this school year, which is a fun program for the brothers and sisters of children with disabilities or special health needs. We have tons of information on our website. Getting connected with us is very easy. You can also follow us on our Facebook or join our closed Facebook page if you're a parent. The name of the closed Facebook page is Vermont Families of Children with Special Health Care Needs. And you can also sign up for a monthly e-newsletter or check out our YouTube channel. I know the puppets have a couple of videos, actually 3 videos on the YouTube channel. One of them with you, Dr. Dickerson, feel free to go and take a look at those. And remember, we're here to help. Please contact us by phone or email. And thanks again to everyone for attending. Thanks again to our 2 great doctors, and have a wonderful day.
Thanks, everyone.
Thank you.